Welcome back. Great to see you all. The Leaders Table. That's the name of this hour with me, Mark Barton. Transformative insights from global shapers. Please do continue to show your support for this via hashtag IGFUAE or at IGF Updates as well. We are streaming live across the world via our media partners. Right, let's talk about the future of health and insurance. And a bit of both. Everything you need to know, but we're afraid to ask. Yashish Dahiya, Chairman and CEO PB Fintech is here. Alisha, Moopen, Deputy Managing Director at Aster MyHealthcare. And Shyatto, Raha, Founder and CEO of MyHealthcare as well. What does the future of healthcare look like, Alisha?
Okay, Mark, so I think the future of healthcare is significantly better and it's going to be very different. And I think it really has to do with 2 or 3 elements, right? You've got the COVID that we've all gone past, and it really kind of accelerated the whole change of healthcare. So 3 things kind of came together. You've got the consumers who want a very different experience when it comes to health. Earlier, people were happy waiting for a while. Earlier, people were not really sure about the different options that were available. Earlier, people were connected to one doctor. What's shifted now is people want it more convenient. They want the data on their hands. So I think that shift of consumerism of healthcare is something that's really changing the landscape, and that is kind of creating a lot of solutions. Second, there's technology that's assisting in this. So consumers might want what they want, but if the technology is not going to support what consumers want, it's not going to make sense. So when you talk about the vaccine delivery of mRNA technology, when you're looking at implants, when you're talking about data and analytics, all of that has come to a point where we can actually have a very different experience of healthcare. And I think third is the capital and the appetite for investment into healthcare. So the combination of these 3 factors are truly transforming healthcare as a sector, which was long needed and the need of the hour.
Your insurance sort of lending products, Yashish, does the same, healthcare and insurance are very closely interlinked, which we'll come to as well. Does the same logic apply, to your business, the consumerization, technology and capital, appetite for capital?
I think it of course does, but I guess we have to break up the healthcare problem a little further, simply because whether somebody's part of the middle class or somebody is really poor, both actually require healthcare and both have health issues. And specifically when you look at very diverse countries, which probably would not apply to the UAE because it's a pretty close-knit small country. But if you look at India, for example, the moment you're 50 miles out of Delhi, you are sort of in nowhere land territory. And what that implies is you need different diagnostic tools. You cannot have doctors everywhere. You cannot, forget doctors, you cannot even have pharmacies everywhere. So you will have to apply technology. And I guess tertiary care is a very later stage problem, but at least the diagnostics, I believe, in a country like India would be 85 to 90% without a physical doctor in any way, shape or form being around. And I guess that's a necessity, otherwise we won't be able to handle the problems, and there'll be too many quacks giving solutions to people and people getting wrong solutions.
Yeah. Shyatto, how is AI and digital technology going to continue to play a role in healthcare going forward?
I think, Mark, thanks so much. I'm going to sort of combine a little bit of what Alisha said and what Yashish is saying. We believe that the future of healthcare delivery will be a tech-enabled healthcare delivery ecosystem. And that's, I think, the stepping stones of that has already started. Telehealth, as Alisha said, and I think we've seen that on the ground, pre-COVID was 0%, post-COVID, we're still seeing, even after COVID has weaned off, 30% of the patients continue to want to use telehealth solutions. Reason being, it's not just the ease of it, it's the fact that they do not want to go into a hospital unless they really need to be there. And I think the way that this entire technology revolution is going to go about is, on one front, I think the enablement is very, very critical, which the point that Yashish was making, which is how will technology actually be able to make healthcare delivery available to a wider audience and to a wider geography. And I think to that extent, democratizing healthcare is going to be very critical. As far as AI is concerned, we've already seen the early deployment of AI, and we've seen sort of rewards back from the clinicians, where if we are able to centralize all the patient records, put meaningful, effective and analytics on it, and make that available to clinicians so that they can take more effective and faster decisions, they are already jumping to it. We've actually seen EMR adoption, which is the electronic medical record adoption, which has been the greatest challenge in the healthcare system, has actually grown significantly because of the availability of AI and digital technology solutions. So I think the revolution of much needed revolution, I would say, of digital technology in healthcare has started, but there's a very, very long road ahead.
Yeah, you concur, Alisha?
Yeah, so I think when we talk about all of the future, it's also really important for us to think about the patient, right? At the end of the day, we're talking about tertiary care, but do you need to get to that point? With the aging population, with the increase in chronic disease, we have to be really thinking about primary care very differently. And I think what's also nice is that a lot of people are much more keener to think about wellness and preventative health. So how do you really kind of make changes as far as primary care segment is concerned? So when you're talking about countries like India, where you've got a very young population. So I was looking at some very scary statistics where they said in 2017, you had 800 million people in the world that were hungry. By 2030, we're talking about only 200 million people who might be hungry. Whereas on the other side, when you're looking at obese people, in 2017, where you have 650 million obese people, by 2030, you have 1.1 billion population of the world that's going to be obese. So you're going to have to be thinking about very different ways of enabling care. So before you get to that tertiary care, how do you manage, as people are living longer, from 45 to 60 to, you're talking about people living to 120, you don't want to have a very sick 6 billion population in the world. So primary care and attaching people to a much more integrated care model is going to be the absolute necessity. If we only try to solve for tertiary care and what to do in terms of advanced diagnostics and surgery, I think we will lose the quality of living, the quality of people's lives, as well as productivity for the entire economy.
One thing that Shyatto has said is that healthcare with insurance will be key for effective healthcare ecosystems going forward. Given that you're more insurance, you're more healthcare, discuss, is that true?
See, I think today's insurance model, where the inpatient health is covered, as well as the billing systems, etc., are not fully integrated, I think that has to change. And what you're talking about is a tripartite basically integration between three things. One is your insurance policy, what it covers, what it doesn't cover. Second is your billing system of the hospital. And the third is really the materials contract between the hospital and the insurance company. And once these three start talking to each other, which should very easily happen through blockchain, it's not a very difficult problem to solve.
Yeah.
I guess your insurance settlement of payments and clarity around that should be so much higher. So that is a problem we should be able to put behind us.
So we see a use case for blockchain in insurance, do we?
I think you'll see a use case for blockchain in almost anything, but I guess it's nothing but a dispersed ledger, and that totally makes sense in something like insurance, where you want everybody to have a full trail of the actions that have taken place.
What about you, Shyatto? You said the comments about insurance and healthcare working closely together. What's your view?
So I think insurance and healthcare have to come together and form what is going to be a tech-enabled healthcare system. Without that, I think it's not going to work. We've already started to what the point that Yashish was making. We've already started rolling out this tripartite ecosystem in the tier 2 cities of India, and we are already seeing success in that. But I think primary care is absolutely critical. We do not, much as I'm sure Alisha would want, definitely is not the right statement for me to make, but we really don't want to try and bring everybody into a hospital. You want to try and bring preventive care and bring them into a healthcare system, which means I don't need you to come to a hospital for me to deliver care. I can manage you at your home and make sure that diagnostics is delivered to you at home. Doctor consult is made available to you at home. All of that can be done at home. We don't have to bring them in. So I think the ability to use technology to make it available to a larger geography is key. And I think the biggest issue that we have as far as insurance is concerned is in India, I'm going to speak more specifically for India, I think we don't have enough people insured. I think we've started the journey again on that front, But the more you have people insured, which means they don't have to worry about getting their preventive health or their inpatient health covered, you will see a better system coming in place.
So a shift from sick care to preventive care. Alisha, the importance of partnerships for a robust healthcare system.
So I think, again, the whole idea of working with the government really kind of came to light with COVID. And that kind of created really good models in terms of outcomes. But now when we're talking about both patient safety goals and patient outcomes, what we're seeing is very interesting collaborations that are happening with either technology partners, like we've partnered with people like Intel, Microsoft, as well as pharma providers on what are the best outcomes for patients for a specific disease. So with GSK and Novartis. So I think those are the kind of collaboration which will enable us not to kind of duplicate efforts and increase costs, because kind of putting the data together, putting the cost structure on tech together is going to be monumental otherwise. So I think combining these forces, which is what like a company like ours at Aster is doing. Yeah. So those collaborations will become very, very powerful.
I'm going to overrun. I'm going to be naughty. Excuse me, everyone. Shyatto, the growth areas. What are the key growth areas for the future of healthcare?
So I think digital therapeutics is going to be one very big area of growth for healthcare in India and globally. The second area is going to be the remote patient monitoring systems. How can we make healthcare available without the doctor actually having to be there at a healthcare center? And thirdly, I think it's going to be the larger penetration of insurance and payers and the availability of an ecosystem. When I say ecosystem, it's going to go one step further to what Alisha was saying, not just pharma companies, but I think also to include the larger ecosystem of pharmacy chains, diagnostic chains, home care providers. They all have to be in the same system, so that what it will do then is centralize all the patient records automatically. It will then also help get the insurance settlement done, and then we can take care of the patients without having to increase our cost of delivery.
Yashish, growth areas?
I think the growth areas, really we need to solve the primary care problem.
Yeah.
And I think we've got 1.5 doctors for every 1,000 population. And that's also lopsided towards the developed world. I guess as far as India is concerned, a lot of that does need to move towards tertiary care and needs to focus on that rather than focusing on the primary side, which should be mostly tech-enabled. I think the last thing I would say is, while insurance is important, we cannot forget the role of government. I think government healthcare spending has to increase simply because I don't think you can, as individuals, negotiate very well with the healthcare system in terms of the costs, but the governments are able to negotiate and implement it at scale in a much better manner. And that negotiation is required, otherwise there's a conflict of interest here, right? One person wants people to fall sick and come to hospitals, but that's not how the world's going to work.
Final words, Alisha, as many words as you want. We're overrunning, we're breaking the rules, we don't care. We're visionaries.
So I think exactly kind of responding to the point Yashish was making, it cannot be this conflict of interest. At the end, everyone is working towards the patient health. So that convergence and eliminating that conflict of interest is important, very, very important. So what we're seeing is, how does the entire system, whether it's government, whether it's provider, whether it's a payer, everyone works towards that ultimate goal rather than having this misaligned incentives.
You were brilliant. Thank you, Yashish, Alisha, Shyatto. Fantastic panel on the future of health. Up next, we've got the future of, drum roll, work. See you in a minute.
Thank you.